It's a very common disease, usually develops in middle age, more common in women. The classic story is someone has a child and a month or so afterwards they start to develop pain, usually directly over this aspect of the wrist. It's worsened with certain twisting or gripping movements, such as opening a jar. One simple test is if you try to throw a fishing pole and the flick of the wrist causes you pain on this aspect of your wrist, there's a potential that you could have wrist tendonitis. So with wrist tendonitis, you can have pain with certain twisting activities, such as opening a jar. Opening doors can also lead to pain. Picking up children is a common description of when patients tend to have pain. Those are the main ways that patients elicit their pain. So the disease develops usually from a swollen tendon. Similar to a trigger finger, you have a swollen tendon here. In this scenario, the tendons are swollen right along the thumb side of the wrist. As they swell, they have trouble moving through some of the adjacent structures, which causes rubbing, which can lead to inflammation and pain. So treatment for wrist tendonitis can range from simply putting someone in a brace and putting them on a non-steroidal anti-inflammatory and giving it time to resolve on its own. Injections would be the next form of treatment for wrist tendonitis. It's pretty successful and can cure these symptoms in 70% of individuals on average. Those that don't get relief from those more conservative measures can progress to surgery, and it's a pretty reliable surgery at relieving the pain complaints. So surgery for wrist tendonitis is same-day surgery. We do it usually under light sedation with a local anesthetic. If the patient desires, we can do it just under local anesthetic to minimize the anesthesia exposure. They go home the same day and they follow up with me in a few weeks to be reevaluated. No heavy lifting usually for a month after surgery, and then after a month it's return full duties. So after surgery, you're in a splint for only about 2 weeks to let the tissues heal in. We start scar massage at that point. The incision is usually a very small incision over this aspect of the wrist. We start the scar massage. Physical therapy is not usually required. Patients are usually able to regain their strength and recover without any supervised therapy.